So lymphoma is a disorder of a lymph node. It is categorized under blood cancer, where the lymph nodes has got proliferation of cells which leads to the swelling of lymph node. To diagnose why these cells are proliferating or what is the cause for this lymph node swelling, we always need to get an excision biopsy done. No FNAC, no core biopsy. Try always to get our excision biopsy, means taking out the complete node to understand what kind of architecture lymph node has and what kind of a lymphoma patient is suffering from. The first important thing we need to understand, lymphoma can be divided into Hodgkin's lymphoma or non-Hodgkin's lymphoma. Hodgkin's lymphoma has got 4 varieties, and non-Hodgkin's lymphoma can again be divided into B cell or T cell. In B cell, we have got 25 varieties, and in T cell, we have got 15 varieties. Not to confuse, what is more important as a layman, as a general public, is always get a biopsy done and always get a second opinion done with immunohistochemistry, because in today's marker, we can actually differentiate between various types of B cells and T cell lymphomas. So we need to understand. First thing is, always if you have a lymph node swelling, get a biopsy done. Second, after knowing the disease, what is the stage of the disease? Stage of the disease could be stage 1, stage 2, stage 3 and stage 4, which we get to determine by doing a PET scan. In those countries where PET scan is not available, I would recommend strongly to get a PET scan done from a neighboring country, because it can upgrade or downgrade the lymphoma staging, which has got overall bearing on treatment modalities. So second thing is, get a PET scan done. And after that, we know what kind of a lymphoma, what kind of a stage. It depends thereafter what kind of a chemotherapy will be utilized to cure this patient. So to give you a ballpark figure, 70 to 80% of Hodgkin's lymphoma will be cured. 60 to 70% patients of DLBCL, diffuse large B-cell lymphoma, will be cured by using a drug called rituximab, which is a targeted medications against anti-CD20, which is affordable and accessible to majority of Indians at this present moment of time. Follicular lymphoma, 80 to 90% people will have a long-term survival. CLL, 80% people will not require treatment at all. So we need to know what kind of a lymphoma you are and pick up these lymphomas early. So message is, think lymphoma. If you have fever, if you have got weight loss, if you have got night sweats and a lymph node swelling, take a biopsy, prove that is lymphoma, and you can get cured with this disorder, which is categorized under blood cancer. Bone marrow transplant is again one of the curative modalities for Hodgkin's and a non-Hodgkin's lymphoma, but not every person requires transplant upfront. In Hodgkin's lymphoma, once you relapse after a primary therapy, bone marrow transplant, again an autologous transplant, 60% people can be salvaged or cured. If people relapse after Hodgkin's lymphoma autologous transplant, you can get to do allogenic transplant from brother or sister, which is called sibling transplant, or from mother or father, which is called haplotransplant or a half-match transplant. Interestingly, in Hodgkin's lymphoma, haplotransplant is doing fantastically well, as good as a sibling transplant. So don't lose hope. Even after autologous transplant, allogenic transplant in 40% people can cure you. In non-Hodgkin's lymphoma also, we can do an upfront transplant in high-risk T-cell lymphoma, which are high-risk like peripheral T-cell lymphoma or ALK-negative ALCL. But in diffuse large B-cell lymphoma, follicular lymphoma, mantle cell lymphoma, once the patient relapses after a chemotherapy is given, you can still salvage 60% of people. So in diffuse large B-cell lymphoma, first therapy is R-CHOP. 60% people will be cured. Out of those, 40% people will relapse. Out of those 40% people, 60% people can be cured by doing an autologous transplant. Autologous transplant is not a surgery. It is taking out the blood from your veins, giving high dose chemotherapy and putting your own stem cells inside you, from where which you have to stay in a hospital for 14 to 21 days to get a faster recovery and to protect from infection. So we all need to understand, in all relapse Hodgkin's and non-Hodgkin's lymphoma, bone marrow transplant can salvage 60% of people. So not to be scared. If you have a relapsed lymphoma, talk to us.